Hello, and welcome to Mazars Healthcare Digest episode 23, Beyond Compliance, Unlocking the Full Potential of Your Data. My name is Faith Sapper-Santos. I'm a director with Mazars Healthcare Consulting Group, and I'm joined by one of our compliance experts, Sunshine Strong, the manager. While today's episode is a continuation of a series dedicated to healthcare surveys, audits, and assessments, we've decided to take it a step further. In this episode, we'll discuss using the full potential of your data beyond compliance requirements.
In today's agenda, we'll be going over regulatory compliance overview, how to optimize operations, how to elevate the quality of care, enhance member engagement, maximize value and manage costs, a couple of case studies, some final considerations, and optimizing your data beyond compliance.
Let's begin by acknowledging that regulatory compliance is non-negotiable in the healthcare industry. With various regulations and general requirements, regulatory compliance's impact is vast. And it's a natural entry point for all health plan operations, as we've listed here, but not limited to, financial operations to ensure that health plans follow all relevant statutes, regulations, accounting standards, and industry best practices. Managed care operations to ensure adequacy of quality services and enhance outcomes. Vendor and delegate management operations, also known as FDR oversight according to CMS, to provide oversight as it relates to performance. Healthcare technology and privacy operations to ensure data quality, control, and integrity, including safeguards to ensure protected health information is kept confidential and secure. Legal, compliance, and contracts operations to provide efficient, effective contract management and performance without compromising quality, as well as ongoing internal auditing and monitoring. Provider relations operations for network management and to ensure data accuracy, completeness and integrity while achieving meaningful provider engagement and alignment. Claims operations to ensure compliant supervision and allocation of resources, claims processing and tracking, adjudication, submission and certification, marketing, public affairs, government affairs operations to protect patients from misleading practices with statutes that limit marketing efforts, eligibility operations to ensure real-time inquiry responses and secure access to eligibility information, enrollment operations to ensure necessary actions for communication, notice obligations, and plan changes, member services operations to ensure meaningful grievances and appeals procedures for timely management and resolution. And last but not least, human resources operations to ensure compliant compensations and benefits, hiring activities, occupational health and safety, and employee supervision, to name a few. The various regulations and compliance requirements help ensure high quality care and intend to protect patient privacy and fair practices, as well as prevent fraud, waste, and abuse, while improving operational efficiency. And with that, compliance relative to operations is a critical function, a stepping stone towards achieving organizational goals.
First, let's talk about unleashing efficiency, analyzing data to identify inefficiencies and streamline processes. Pinpointing inefficiencies through data analysis involves a comprehensive examination of claims data, provider performance metrics, and member utilization patterns. It empowers health plans to make data-driven decisions, optimize operations, enhance the quality of care, and ultimately improve the overall member experience. It's about identifying opportunities for improvement and taking proactive steps to address them, resulting in a more efficient and effective healthcare delivery. First up, claims data analysis. By thoroughly analyzing claims data, health plans can gain valuable insights into the utilization of healthcare services. Some examples are identifying overutilization or unnecessary procedures. While monitoring claims for these potential risks is a regulatory requirement for fraud, waste, and abuse, by examining claims for services, tests, or procedures that are frequently performed but may not always be medically necessary, you can identify cases of overutilization. This insight allows health plans to work with providers to ensure that resources are used more efficiently outside of just spotting non-compliance. Spotting billing errors. Claims data analysis can help uncover billing errors, such as double billing or incorrect coding. This not only saves money, but also ensures accurate reimbursement to healthcare providers. And provider performance assessment. Claims data can be used to assess the performance of healthcare providers. You can identify which providers deliver cost-effective care with good outcomes, and those who may need additional support or guidance. Next up is provider performance analysis. Analyzing provider performance is a critical aspect of pinpointing inefficiencies. This involves evaluating how healthcare providers are delivering care and managing costs. And here's what that entails. Cost-effective care. By comparing provider performance data, you can identify those who are delivering high-quality care while efficiently managing costs. Recognizing and rewarding these providers can encourage others to follow suit. Variations in care. Data can reveal variations in care practices among different providers. Identifying these variations allows you to standardize care protocols, ensuring consistency in quality and cost. And patient outcomes. By examining patient outcomes data, you can assess the effectiveness of different treatments and interventions. Providers with better patient outcomes can serve as models for others. And finally, member utilization patterns. Understanding how members utilize healthcare services is crucial for optimizing resources and improving member satisfaction. And here's how that data analysis can help in this area. Member utilization profiles. Analyzing member utilization patterns can help create member profiles. This includes identifying which members frequently utilize certain services or are at risk for certain health conditions. These profiles can inform targeted interventions and wellness programs. Predictive modeling. Data analysis can be used to build predictive models that anticipate future healthcare needs based on historical utilization patterns. This allows health plans to proactively address member health and reduce costly emergency interventions. And finally, resource allocation. By understanding member utilization patterns, you can allocate resources more effectively. For example, if a certain demographic consistently uses telehealth services, you can invest in expanding telehealth options to meet those needs.
And next, another strategy is elevating the quality of care. Health plans have an opportunity to leverage compliance data for informed decision-making and optimized healthcare delivery to enhance patient outcomes. Data can provide insights into the effectiveness of different patient treatments and interventions, offer evidence-based recommendations, and yield quality reporting and transparency. One of the most valuable aspects of data in healthcare is its ability to provide insights into the effectiveness of various treatments and interventions. A closer look at how this works is with outcomes analysis, where health plans can analyze historical patient data to assess the outcomes of different treatments and interventions. This analysis may involve looking at mortality rates, readmission rates, complication rates, and patient satisfaction scores. By using this level of analysis, health plans can engage in member education for managing diagnoses, as well as offering preventative care options. Comparative study data also enables health plans to conduct comparative studies to determine which treatments or interventions yield the best results for specific conditions. This can involve comparing the effectiveness of different medications, surgical techniques, or therapeutic approaches. By analyzing data from top-performing healthcare providers, health plans can also identify best practices in healthcare delivery. These best practices can then be disseminated to other providers to raise the overall quality of care. Data-driven insights allow health plans to offer evidence-based recommendations to both healthcare providers and to patients. This is crucial for improving the quality of care. For instance, health plans can develop or endorse clinical guidelines based on robust data analysis. These guidelines help providers make informed decisions about treatment plans, ensuring that they align with the latest evidence and best practices. For individual patients, data can be used to create personalized care plans. By considering a patient's medical history, risk factors, and treatment responses, health plans can tailor interventions to maximize their effectiveness and minimize potential side effects. Data can also be used to optimize medication management. This includes identifying potential drug interactions, monitoring medication adherence, and recommending adjustments to doses or dosages, or prescriptions as needed. Data also plays a role in quality reporting and transparency activities. Health plans can use this data to track and report on quality metrics like HEDIS measures. This provides quality of care transparency and accountability. Health plans can also create provider scorecards. What this does is it showcases individual provider performance metrics that enable patients to make informed decisions about their healthcare choices. Another strategy is to enhance member engagement by understanding your members' preferences, their behaviors, and their health needs. You can tailor communication, offer targeted programs, and provide proactive support. This not only increases member engagement, but also leads to higher satisfaction, better health outcomes, and improved member retention, ultimately benefiting both the health plan and its members. This strategy focuses on leveraging data to understand your health plan members on a deeper level, which enables you to create personalized, member-centric experiences that boost engagement and overall satisfaction. It's crucial to start with creating detailed member profiles based on data analysis. This includes collecting and analyzing data on various aspects of your members' healthcare experiences. For instance, understand the demographics of your members, such as age, gender, location, and socioeconomic status. This also helps tailor communication and services to specific groups. Collect and analyze member health histories, including past illnesses, chronic conditions, and family medical history, which will provide insights into their unique health needs. Track health behaviors like diet, exercise, and smoking habits. This will help you identify opportunities to encourage healthier choices. Also examine utilization patterns, like how frequently members use healthcare services, which providers they prefer, and their prescription histories. This can all inform strategies for care coordination and cost-effective care. And once you're armed with the member profiles, health plans can then develop personalized communication strategies to engage members more effectively, as I had mentioned. For instance, data can help identify members who may benefit from preventative screenings, vaccinations, or wellness programs. Health plans can then target that outreach with meaningful messages and reminders. By analyzing member health data, you can identify areas where members may need additional health education. Personalized content can be created to address specific concerns or conditions. Data can reveal how members prefer to receive information as well, whether it's through emails, text messages, phone calls, or in-person interactions. Tailoring communication channels to members' preferences really does increase the likelihood of engagement and overall member satisfaction. Member engagement can be enhanced by offering wellness and disease management programs tailored to individual health needs. For instance, risk stratification data analytics can be used to stratify members based on their risk profiles. Those at a higher risk for certain conditions can be enrolled in targeted programs aimed at prevention and early intervention. Data-driven care plans can be developed for members with chronic conditions. These plans outline specific interventions, monitoring, and goals to help members manage their health effectively. Health plans can use this data to identify members who have achieved health milestones or who have actively participated in wellness programs. Rewarding your members for their engagement can be a powerful motivator. Data analytics, including predictive modeling, can help identify members at risk for developing certain health conditions. This enables that early intervention and preventative measures. Predictive analytics can flag members who may be a high risk for hospital readmission, complications, or deteriorating health. Health plans can proactively offer support and resources. Health plans can also provide members with wearable devices or remote monitoring solutions to track vital signs and symptoms. This real-time data can be used to intervene when necessary. And lastly, to ensure ongoing engagement, it's essential to establish feedback loops that allow members to voice their concerns, their needs, and preferences. For instance, regularly collect feedback from members through surveys and feedback forms, and then use this input to refine your services, communication, and programs. Also, it's important to analyze member complaints and issues to identify trends and areas that require improvement. Promptly addressing concerns and resolving complaints demonstrates a commitment to member satisfaction. And lastly, but not least, maximize value and manage costs. Health plans can use compliance data to gain insights into financial optimization and cost management. Maximizing value and cost management through data analytics involves using data-driven insights to make informed decisions about resource allocation, network management, and cost control. This data-driven approach is essential for achieving improved financial sustainability, controlling healthcare costs, and delivering value-based care. By connecting the power of data, health plans can operate more efficiently, provide better care to members, and maintain their financial viability in a constantly evolving healthcare landscape. Data analytics provide a wealth of information that can guide health plans in optimizing resource allocation. For instance, provider network optimization. Health plans can analyze claims data to identify which healthcare providers offer cost-effective and high-quality care. This information can guide decisions on which providers to include in the network and negotiate favorable contracts. Analyzing data can reveal trends in member service utilization. Health plans can identify which services or treatments are in high demand and allocate those resources accordingly to ensure timely access that's essential to care. Predictive analytics can also help health plans anticipate spikes in the healthcare demand, such as flu seasons or the need for specialized services, to enable proactive resource planning and allocation. Effective network management is essential for controlling costs and ensuring members have access to quality care. Data analytics can assess the performance of healthcare providers in your network. This analysis can identify outliers and enable health plans to work with providers to improve efficiency and quality. By analyzing geographic and demographic data, health plans can determine whether there are gaps in the network or areas where providers are oversaturated. This informs decisions about network expansion or optimization. Data can be used to match members with the most appropriate providers based on their needs, location, and historical preferences. This also enhances member satisfaction and ensures efficient care delivery. Cost control is a critical aspect of maintaining the financial sustainability of health plans. Data analytics can flag unusual billing patterns or duplicate claims, which may indicate fraudulent activities. Detecting and preventing fraud, waste, and abuse can lead to significant cost savings. Health plans can analyze cost variances among different providers, services, and regions. Identifying areas with high costs allows for targeted cost reduction strategies. Data can help determine which treatments or interventions provide the best value in terms of cost and outcomes. This information can guide decisions about coverage and reimbursement policies. Data analytics can strengthen health plan contract negotiations with providers and other stakeholders. And now that you are armed with data on provider performance, utilization patterns, and cost effectiveness, health plans can then negotiate contracts that align with their goals, emphasizing value-based care and cost containment. Health plans can use data to implement the pay-for-performance models that reward providers for delivering high-quality, cost-effective care. These models encourage providers to focus on outcomes rather than volume. Comparing your health plan's performance to industry benchmarks and your peers is crucial for identifying areas for improvement. Data analytics will allow you to benchmark key performance metrics such as administrative costs, claims processing efficiency, and member satisfaction against industry standards. Analyzing data on competitor health plans can provide insights into strategies and performance, helping you make more informed decisions on how to remain competitive. Now that we've discussed the art of data optimization and how to use your data beyond compliance by pinpointing inefficiencies, elevating the quality of care, enhancing member engagement, as well as maximizing both value and cost management, Sunshine is going to walk us through some case studies for real-life context.
First up, we have Health Plan a medium-sized health plan in California that enlisted the services of Mazars to conduct an NCQA Net 5 readiness assessment for their online directory services. This assessment was a pivotal step in their pursuit of comprehensive NCQA accreditation. Mazars tailored bespoke tools and processes to align with the health plan's specific requirements, all while exploring opportunities to extract additional value from their data. In conjunction with delivering the NCQA readiness scores, we also provided a comprehensive data analysis of the assessment results. Company A leveraged these insights in the following ways. First step, data cleansing for a DHCS audit preparation. The regulatory data from the readiness assessment proved invaluable for enhancing accuracy in preparation for their upcoming DHC audit. This dual application of the regulatory data allowed a more efficient approach to resource utilization. Using data already collected to prepare for a secondary regulatory audit rather than conducting additional DHCS-specific outreach freed up the health plan's data team for other projects. Second, provider roster enhancement. The Net 5 assessment's meticulous scrutiny involved direct outreach to provider offices for the verification of demographic information sourced from the online directory. Beyond merely earning a passing score, any discrepancies were diligently noted. These insights not only facilitated demographic data improvements, but also led to the updating of provider rosters for each office, accommodating providers who had terminated their affiliation or moved locations. Third, user interface redesign for enhanced customer satisfaction. While the assessment ensured all components met NCQA accreditation standards, it revealed that the user interface required a design overhaul. Consequently, the health plan initiated changes to the interface, thereby enhancing member satisfaction scores. Notably rectifying the issue of partial searches yielding 0 or intermittent results was among the improvements made. Usability testing further influenced adjustments, simplifying language and optimizing link placement for an intuitive user experience. And finally, open panels audit. During the verification process, the accuracy of providers' acceptance of new patients was thoroughly examined. The data gleaned from this exercise was instrumental in updating the panel status for all contacted providers, thereby ensuring the plan's readiness for new patients. In conclusion, Company A's journey exemplifies how harnessing regulatory data goes beyond compliance, presenting health plans with multifaceted advantages, including data accuracy, enhanced user experience, and the ability to readily adapt to changing markets. Company B, a large health plan based in Colorado, engaged the services of Mazars for a comprehensive evaluation encompassing both DOI and NCQA timely access surveys. We conducted this survey using a discrete secret shopper methodology. Rather than undertaking two distinct surveys, Mazars devised an approach that amalgamated the essential elements required for both surveys within a single outreach call. This innovative method not only streamlined the process, but also resulted in notable reductions in outreach time and budgetary requirements. Due to the nature of a secret shopper survey needing knowledgeable surveyors, we deployed clinical nurses armed with tailor-made scripts for the survey. These professionals documented each interaction, maintaining detailed records throughout the outreach process. In the lead up to the outreach phase, Mazars executed stringent data preparation involving rigorous data cleansing and in-depth research. The information refined during this phase was subsequently harnessed by the health plan to comprehensively update the provider directory, ensuring it reflected the most accurate and up-to-date provider details. Going beyond the immediate update of the provider directory, the health plan leveraged the wealth of information gathered during this comprehensive evaluation. Valuable insights obtained from the survey comments collected by the outreach staff were analyzed and thoroughly filtered to identify areas for further enhancements. This proactive approach led to the development of a specialized provider education modules aimed at ensuring that provider offices remain well informed about the full spectrum of benefits offered through the health plan. Additionally, these modules serve to raise overall awareness among the provider offices regarding the wealth of resources provided by the health plan. In summary, Company B's collaboration with Mazars demonstrates how innovative survey methodologies, data refinement, and careful scripting can contribute to a more efficient, cost-effective, and provider-centric approach. This strategic outlook not only enhances the accuracy of the provider directory, but also fosters a strong collaborative relationship with the healthcare community, ensuring a higher standard of care and service for health plan members.
Thank you, Sunshine, for translating what we've discussed into real-world scenarios. So recognizing that health plans often struggle with the massive amounts of data and information generated and consumed, which is what we would consider a data tsunami, The challenge is to avoid analysis paralysis, but transform all of it into meaning and actionable insights. Insights to identify new opportunities, to manage risk exposure, assume a proactive culture, and to solve for compliance and operational issues, all the while adding value to the plan's mission and objectives. The lack of overall data maturity and limited experience can often get in the way of a health plan's ability to fully unlock the value of their data. Solutions should be implemented with a well-established data governance framework that includes, but is not limited to, a well-defined data architecture that enables successful data-driven decision-making, regulatory reporting, compliance monitoring, and aligns with its operations. With the prevalence of data breaches on the rise, data privacy and security are critical. An effective data architecture incorporates strong encryption, access controls, and data governance to protect sensitive data, as well as maintain data quality and performance. The common saying of garbage in, garbage out means that the results are only as good as the information that's provided. So in other words, data quality in all of its attributes is absolutely critical. Health plans can leverage artificial intelligence, also known as AI, to help discover those unusual, unexpected, or abnormal data patterns, as well as potential compliance violations. And so with all of that said, there has to be an emphasis on data accuracy, completeness, and traceability so that you get high quality data.
Thank you, Faith. Understanding that regulatory compliance is a natural entry point for all health plan operations, we encourage you to optimize your compliance data. Through analyzing and understanding your data to predict, detect, and optimize outcomes. Through transforming to a data-driven culture, including data relevance, availability, meaningful decision-making, and promoting data literacy across the health plan, and leveraging AI to ensure high-quality data. If nothing else, stay adaptable and innovative. Now that we know that data is more than just a regulatory compliance requirement, it's a treasure trove of insights. We hope you walk away from today's episode with the realization that you can transform your data from a mere requirement to a powerful catalyst for change. Thank you for listening to this episode of Healthcare Digest. We hope you found it informative and identified potential new ways to optimize your data. Please reach out to Faith or me if we can answer any questions, or if you'd like to discuss how your organization can transform your data from a mere requirement to a powerful catalyst for change.